Durban 90.4 FM, Peter Maritzburg 105.6 FM.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والعاقبة للمتقين والصلاة والسلام على رسوله الكريم سيدنا محمد وآله وأصحابه أجمعين برحمتك يا أرحم الراحمين. All praise due to Allah, the Lord, cherisher, nourisher, sustainer and master of the universe, the most gracious, the most beneficent, the most merciful. Ya Allah, it is only you that we worship and your guidance that we seek. Ya Allah, keep us in a straight path. Ya Allah, show us your choice of blessings. Ya Allah, show us your mercy. Ya Allah, guide us. Greetings, salam, salutations on our beloved Nabi Muhammadur Rasulullah sallallahu alaihi wasallam. It is Tuesday evening, so it's time for Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. And we welcome our listeners on Radio Al Ansar, CII Radio, Voice of the Cape, Radio 786, Sirius FM, Radio Islam and IFM Port Elizabeth, and all listening to us on audio streaming and other platforms. Our topic for discussion is management of disabilities, and we intend discussing management of stroke, cardiac issues, heart failure, arthritis, etc. And we welcome our very special guest, Brother Ebrahim Meer, a biokineticist practicing in Durban. Ebrahim, assalamu alaikum wa rahmatullahi wa barakatuh. Jazakallah khair for joining me in the program this evening.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you for having me, and thank you to your listeners for tuning in tonight.
It's an absolute pleasure hosting you, Ebrahim. Now, before we start our discussion, I have to introduce our guest. Ebrahim Meer is a biokineticist. I'm getting that pronunciation
It's
right.
getting better over every show.
Absolutely. A biokineticist, a biokineticist in South Africa, based in Durban at the Ahmed Al-Qadi Private Hospital. He's experienced with working with strokes as well as other special conditions such as spinal cord injuries, etc. He has had much success in re-establishing gait patterns and helping patients to walk again. He also specializes in robotics, wearable bionics, amongst other equipment to help recovery from strokes and various other orthopedic and sporting injuries. Now, Ebrahim, let's just start off. Maybe you can explain to us what is biokinetics, I got it, biokinetics, and how it differs from other forms of therapy.
So basically, a biokineticist is a professional who is registered with the Health Professionals Council of South Africa, and we are there to prescribe or actually fight or combat diseases and other conditions using exercise prescription. So scientific exercise prescription per patient, which is individualistic. So it's not a one-size-fit-all sort of profession. Each person, it's quite individualistic, and we use exercise as the modality, or as the main modality of re-establishing complete recovery.
Let's just talk about stroke.
Yep.
Okay. I know you want to keep this discussion general, but let's just talk about stroke. What role does a biokineticist play in the rehabilitation process after a stroke?
Okay, so basically, by definition, if you had to break down a stroke is known as a cerebrovascular attack, or what is known as a brain attack. So how you would have a heart attack, your brain has some form of attack, either in the form of a brain bleed, or you have an embolism or something like a clot, which is then moved around and then blocks a pathway, and so you have an obstruction. This can then lead to a stroke, as well as obviously your lifestyle conditions such as high cholesterol, diabetes, and the common stuff that we see in patients. Once you have a stroke, you do have, obviously, at a pathophysiological level, you have things happening, and your surgeons and your doctors fix that immediately in an acute setting. But post the stroke, you have, depending on the severity of the event, you have effects on the body. So you'll have spasticity in some patients, which is tightness. You'll have gait issues. People won't have a proper walking pattern. A lot of people lose their arm function, their finger functioning. And sadly, a lot of these people are told that they wouldn't be able to regain most of the function. But what we have found is that with rehabilitation, if you implement it at early stages, or even at some point in your recovery, you could benefit yourself in the long term, and you could regain function, hopefully, in your arms and your legs, or the affected limbs that you have experienced a stroke with.
You're correct, but many of us are of the opinion and of the impression that once you get a stroke, that's it. So there is hope after all.
100%.
Excellent, excellent. Now, how do you assess a stroke survivor's physical abilities and create a personalized rehabilitation plan?
So again, it's individualistic. There's obviously protocols that we use as biokineticists. We use different set protocols to assess. There's also muscle testing that we can do. There's gait analysis that we can do, posture analysis as well. So we get a full comprehensive out view of what needs to be worked on. And then we take it session by session, and obviously patient interaction is important. You check in with the patient regularly to see how they're doing, and you just determine your progress as you go along. But compliance is the other thing. So patients have to stay compliant with the program. It's not like you can do a session on a Monday and then see us again 2 months later and then expect a full recovery. It can't.
It has to be something that is constant.
Yep.
And does this happen when I say in-house? Does someone have to be admitted to a hospital, or does one have to come to your practice, or
So currently we work in an outpatient setting. So it's an outpatient facility set up for rehabilitation. However, there are centers that exist within our country, within the structure, that have in-house rehab and care facilities. So you're not just restricted or limited to outpatient facilities. There's ways and methods that you could seek rehabilitation in any form.
It gives a lot of hope to patients, really. It gives a lot of hope what you're telling us.
Yep.
And let's talk about exercise and physical ability. What types of exercise are most beneficial for stroke survivors, and how do you incorporate them into your rehabilitation plan?
So by the time a patient with a stroke sees us, they would have gone through the whole multidisciplinary approach, meaning that they would have been discharged and then seen by a physiotherapist, hopefully, and then from the physiotherapist being sent over to a biokineticist. With regards to the exercises, again, it all depends on what's affected and what we find in your initial consultation, and then we sort of work on that. But it's a lot of exercises to try and build back the endurance for the patient, because most of the time you're going from a long period of bed rest and a long period of not moving much, so you're basically sedentary for a long while. So we have to combat and rebuild the patient from a perspective of fitness. You have to look at every component. So we have to work on his endurance, his flexibility, his muscular strength, his balance and proprioception. All of that has to be integrated into a program, and then over a period of time, with compliance from the patient, you would see almost full recovery.
In fact, you used the word over a period of time, and my next question to you was going to be, how long does one have to go through this process?
So if from my experience and dealing with stroke survivors, I would tell you that there's no fixed period. It all depends on your age. It depends on your level of movement, how much of a stranger you are to physical activity and exercise in the first place. There's a whole lot of variables that will determine your recovery period. I know people who have not recovered maybe 15, 20 years post-stroke. They still have effects from the stroke, yes.
But are they still doing the rehabilitation process?
They still try.
Exercises?
They still try. You never give up.
Yes, no, of course. It was just, I was just wondering, how long this thing took, because obviously, when you go into any program, it's fixed. You can take so many tablets, so many times a day for so many days, and something's going to happen.
Yes, so that's an important point you raise, because a lot of the time, management-wise of these conditions, people just sit back and then manage post-stroke by using pharmacological agents or the drug therapies. Drug therapies and pharmacological agents will take you only so far. And then beyond that, your body has the natural phenomena of aging. So if you combine the aging and the drug therapy with no exercise and no movement, or minimal movement and exercise, it's a recipe for disaster.
Yes, I'm sure it is. We are discussing management of disabilities from a biokineticist perspective, and we have in the studio with us Brother Ebrahim Meer, who is a practicing biokineticist. And if you have any questions for Ebrahim on the management of any form of disabilities, we are discussing stroke right now, but we will be moving onto other disabilities as well. You can forward to us your questions via WhatsApp on 060 904 1056. 060 904 1056. We look forward to your questions for Brother Ebrahim. Ebrahim, can you discuss the importance of aerobic exercise and cardiovascular fitness in stroke rehabilitation?
It's quite important, and actually very important, because remember, every movement of life requires a heartbeat, and that heart to deliver blood to the oxygen or to the working muscles. So with aerobic exercise especially, we found that endurance of these patients, people probably could only walk 3 kilometers before, are now able to walk 5 kilometers in the space of probably a few months, just by doing a little bit of cardiovascular exercise. So the chronic adaptations that you have to the cardiovascular system are quite beneficial. So just a few, like recapitalization and revascularization, where you have formation of new blood vessels along the way. Those things are your chronic adaptations to aerobic exercise. So obviously the more it has to be graded, so we can't just get anybody to just come in and then start pushing them to do a certain amount of work, because it can't. You need to grade them and consult with them first.
It has to be regulated.
That basically so graded exercise prescription along with compliance and all of those effects, like left ventricular hypertrophy and actually getting your cardiac output to increase, those things are bound to happen if you stay at rehab.
Now, I know you are speaking the truth, because your wife, who is also biokinetic and who's sitting in the studio, is acknowledging everything that you are saying. I can just see it. Excellent. But I'll bring you on air shortly too. Don't say. Okay, let's talk about mobility and balance whilst we're on the question of stroke. How do you address mobility and balance impairments in stroke survivors, and what exercises are most effective?
Okay, so there's a host of them, but just to give the listener perspective as to what a stroke patient goes through, there's something known as hemiplegic weakness or hemiplegia that a stroke patient typically has, which is one hemisphere or one half of your body is completely paralyzed, or you have diminished sensations. With that, if you try and walk, it's like walking on one leg even though you have two, and so balance is definitely affected, and with that comes your increased fall risk. So if a patient then tries to attempt a walk or try and attempt a jog or a run and they lose their footing, they don't just get the trauma from the fall, they also can't feel on the one side. So the extent of the damage could be greater than what the patient perceives. And a lot of the time with falls and stuff that you have at home, you'd write them off for just being a nigger or just a fall on the day. But on further investigation, you'll find that there might be other deeper underlying issues. So it's always good to note that if you do have a fall or if you're experiencing pain, use your relative imaging techniques and use your relative investigative techniques to try and find and figure out what's going on.
So, let's talk about the role of assistive devices such as cranes, walkers, etc. in stroke rehabilitation. What role do they play?
They play a crucial role, and they're quite important as well, because patients, unfortunately, obviously I'm looking at things from a medical perspective and from the healthcare perspective, but a common patient out there wants to get back to work, wants to get back to life, and you can't expect the patient to have weeks and months of recovery. So they're looking for the quickest way to get back into their routine. So these aids, the walking aids and the canes and all of these things, they help you to reestablish your gait and try and get you back to your feet, but they're not your end goal. Your end goal should be obviously independently walking again, but that will take time and rehabilitation.
It's time for us to take an ad break. Remember, your questions via WhatsApp 060-904-1056. Let's visit the marketplace.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
حديث a day. قال رسول الله صلى الله عليه وسلم أطعموا الجائع. Feed the hungry. To feed the poor and hungry is an action that will be greatly rewarded by Allah subhanahu wa ta'ala. A Muslim should not fill his stomach whilst his neighbor remains hungry.
This hadith is sponsored by Ashraful Aid, International Humanitarian Organization.
Are you looking for a meaningful way to fulfill your zakat obligation? Look no further than Ashraful Aid. With our trusted track record, your zakat reaches those who need it the most in the most honorable and dignified manner. visit our website at www.ashrafulaid.org.
Yellow Ansar Helping Hands with Aisha Jamal brings you the Animal Welfare Campaign. Help us make a difference.
Hey little bird.
Nabi Sallallahu Alaihi Wasallam said, "Verily, there is heavenly reward for every act of kindness done to a living animal." We are in need of cat food, dog food, blankets, shelter, weatherproof kennels, and funds towards the above, as well as towards urgent cases where animals require medical attention. WhatsApp 060-971-9955 or 084-3041-683. Drop-off zone 207 West Road, Overport. Yadul Ansar, making a difference.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickville Road, Overport. Simplex Radio, the name you can trust.
At Amina's Wonder Spice, we know that many of you already enjoy the pleasure of cooking with our 100% pure ginger and garlic. Our unique masala paste have created a new dimension and variety to your dishes. For all these reasons and more, we've called it a Wonder Spice. Amina's Wonder Spice, creating a unique taste in a paste. Available throughout South Africa, neighboring countries, and also in the UK. Contact us on 031 577 5023 or www.aminaspice.co.za.
We'd love to meet you. Pay us a visit. Radio Al Ansar.
You're listening to Medical Files, and Medical Files is brought to you by the Islamic Medical Association of South Africa, and tonight's show is hosted by myself, Faizal MJ Suleman. Our topic for discussion is management of disabilities from a biokineticist perspective, and our special guest this evening is Brother Ebrahim Meer, a biokineticist who practices at Wansbeck Rose in Westville. And we have been discussing strokes thus far, but we're going to be moving the focus onto other disabilities. Just to remind you again, you can forward to us your questions on 060-904-1056. These are questions that can be sent to us via WhatsApp. Okay, Ibrahim, the first question that comes to, who do you go to for osteoarthritis and osteoporosis? And there's a little thing after that says, I'm so happy and amazed and surprised to learn that there is hope after a stroke.
Glad. So the first question is, who do you go to for osteoarthritis and osteoporosis? So I think it'll all start off with your signs and symptoms firstly. So let's start all the way at the beginning. Signs and symptoms, if you're experiencing any signs and symptoms and you think that you might have a particular condition, start off at your GP. So your general practitioner is your guy. He will then direct you down the passage to where you need to go.
Okay.
And I think you need to go down that route. Don't skip specialists. Don't jump the queue. You might just freak yourself out for nothing and then end up spending more on your medical costs than you might expect, when you could have went the simple route and solved an issue.
Excellent. Okay, a message from our sister Jamila says, Assalamu alaikum wa rahmatullahi wa barakatuh. What is the difference between physiotherapy and biokinetics? Would it be prudent to check whether step-down rehab hospitals have both a physiotherapist and a biokineticist? Jazakumullah khair.
I can tell you about the differences. I don't know about the latter.
Okay.
So the differences between a physiotherapist, and I think we complement one another, because the professions are both trying to establish the same goal, getting a patient back to recovery. But the initial stages and the initial recovery with the controlling of the swelling and mobility, pain management, all of that stuff, you would go down the physiotherapy route. And then once you've done with the physiotherapist, you will then come over to us for your final phase rehabilitation, and we will then get you back to normal living and return you back to your sport if you're a sports person.
Okay. Another question comes in. This comes to me privately. Where does an OT and an OT fit in?
So
occupational therapy.
Yes, we all fit into the same multidisciplinary team. depending on your cases. So especially with learning disabilities, with mental disabilities, work-related issues, occupational therapists would benefit patients lots with those. So again, it just depends on what your condition is and which part of your recovery you're at. It depends on which professional you're going to end up seeing.
Now, we spent I was about to say we spent some time on stroke, but there's another question that's come through. I am a 65-year-old female and an avid walker. I have recently started feeling lots of pain on the inside of my right knee. I have taken some painkillers and attempted some exercises. It's quite painful, especially when climbing stairs. I can't bend when making my salah. Please advise. I think it's more for an orthopedic.
Could be, but
let's give the biocognitive
so again,
review.
your method of management is important. You want to manage this conservatively. You want to manage it via your drug therapy. You want to manage it via surgery. It depends on how and what you want to do as a patient, and then you visit your relevant specialist or professional, and then direct you from there. But a biokineticist in your instance can benefit you.
No, but if you can, then how can you benefit her?
So we could assess you, and then we can do particular tests to see whether you need to then go off to an orthopedic surgeon or not for further investigation. And we can then strengthen, if it's a minor issue, we can try and strengthen up the muscles that support the knee, and hopefully that could benefit you quite a bit.
Thank you so much for that, Ebrahim. Now, Ebrahim, you did mention to me that besides stroke, there are various other conditions that you deal with. You spoke of spinal cord injuries. You spoke of autism.
Yes.
I know there's cardiovascular stuff. Can we just discuss some of the other conditions that you deal with? Let's start maybe with the spinal cord injury.
So spinal cord injuries, quite broad as well. So there's different categories and obviously classifications of the spinal cord injuries. So the main two being your complete and incomplete spinal cord injuries. With complete spinal cord injuries, it does not mean that a patient would not benefit from rehabilitation because it's set that they're not going to establish a gait again, or they might not experience a full recovery. For as long as you're breathing and you're living, you have to give the body what it needs. So whether you have a full cord injury or incomplete spinal cord injury, the exercises and the rehabilitation is equally important. Patients with SCIs usually have lots of spasticity, tightness. In some instances, they have flaccidity, meaning that they're super loose on their joints. A lot of them don't have balance and proprioception. Lots of them have motor sensory deficits. So as biokineticists, we use the exercises that are prescribed for particular postures and particular instances with patients to try and get them to get to the optimal level of feeling or back to full recovery.
And then if there's somebody that's suffering from autism, how does a biokineticist?
So you often hear this with many conditions. I think autism, again, is a spectrum. So it depends on where on the spectrum you fall and how badly you're affected by the condition. Also your age range as well. Individualistic patient needs are considered here, because with autism, it's very, very unique problems that these kids or adults face.
Cardiac. Let's go to cardiac, and I think that's going to take us a bit of time.
Yeah, with cardiac issues, I look at 2024, I saw lots of elderly patients, and with the elderly, a lot of them are experiencing either they're hypertensive, or they've been post-stroke, or they've been post-stented, and they've had cardiac issues. Some of them are in cardiac failure as well. So you got left or right-sided heart failure that can be affecting the patient. With this, I think the chief complaint has to be, I want to maintain my walking, I'm traveling, and I want to keep my stamina or my endurance as it was. And the thing is, it comes along with not only rehabilitation, but also dietary modification and lifestyle modification. So if you look at all of these diseases such as hypertension, diabetes, cholesterol, all of them are termed as lifestyle conditions. So if you modify your lifestyle to some extent, you could see changes along the way. Don't rely solely on the pharmacological or the drug therapy alone, because you have organs within your body. And sometimes when you're taking medications too much, too often for a particular condition, you could damage the other organs. So I think keep your organ health in mind as well.
Sorry, I'm trying to read this one question that's come through. Okay, we'll deal with that just now. Tell me, how do you address like modifiable risk factors like hypertension, high cholesterol, smoking, etc. in cardiac rehabilitation?
So with hypertension and all of the cardiac stuff, the lifestyle factors that do affect you are your diet, your sleep, sleeping quality, your sleeping patterns, and then your overall exercise routines. The things that you can change would be your sleeping patterns and your diet, etc. The things that we can't change would be your genetics, your height, obviously, and well, in this day and age, you can change your height apparently in India.
Can you?
Yeah, you can. Yeah.
Okay.
So you can change certain things if you make those changes. If you work on your diet, your meals. A lot of people are trying out different methods of weight management, such as intermittent fasting and a particular diet that they might follow. Those are attempts, even though they might not see immediate results. I think if you give it a shot or you try and attempt something, stay at it for a bit, and then when you see the results, you just keep at it.
I'm sure that nutrition, diet, etc., play a huge role in cardiac rehabilitation.
Very important, because you can't have an individual having a heart attack and then post the heart attack coming in for rehabilitation, but he's having the same food and the same routine and the same meals that he used to have previously. By the law of the fact that it's a lifestyle condition, if you're not going to change your lifestyle post the event, it just means that you managing your symptoms with the drugs after, and that's not going to get you anywhere.
So lifestyle changes play a huge role.
Yes, especially with diabetics. And I say this because in 2024, I saw lots of naughty diabetics. When I say naughty diabetics, it's ones that, you know what, we're taking our medication, but we still...
You mean those that say we won't have sugar in our tea, we'll have 4 biscuits with it?
There we go.
That's okay. 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 Question comes in. Evening, doc. I had a femur fracture. Had it pinned last September. I'm walking with a tripod. Still can't reach down to my feet. Will I be able to walk without a tripod at all? Please advise.
Hard to advise without visualizing, without seeing you, but I've had many patients with those fixations and they walked off independently. From my experience, I'm not sure broadly, but from my experience dealing with people, I think you could benefit from seeing a biokineticist, and you should.
No, so there is hope, that means.
Definitely.
Yeah, no,
Definitely.
That's most important, because I think that's what the listener wants to know, that will I be able to walk without a tripod at all? And alhamdulillah, there is some hope. So inshallah, I'm sure they contact a biokineticist, then we can we can get some results. 060-904-1056. We are talking to Ebrahim Meer, a biokineticist practicing in Westville, Durban, and our topic for discussion are management of disabilities. There's various disabilities that Ebrahim Meer deals with, and of course, if there's any particular disability that you want to discuss where you need some sort of rehabilitation, then you can forward to us your questions on same. Now, I'm sure that you sort of create personalized rehabilitation plans for individuals with disabilities, etc. Now, how do you assess and create these plans?
So there's different components that we look at. So like different variables, your strength. For that, we use muscle testing. So there's various devices that we can use. We have devices that we can use that we can quantify your strength with. We have for range of motion, we have devices that can actually give you quantifiable figures and amounts for each joint of your body, what's its particular range. So we use those ranges and we use the data that we find against norms, which are scientific norms, which have been graded already. And from there, we're able to assess. So for instance, Mr. Suleman, at 50 years old, you're supposed to be within this particular range. You're now underneath or above, and this is what needs to be worked on. This is what we can do going forward. So it's sort of a well-rounded approach.
I was going to ask you whether technology plays a huge role, but it's time for the Isha Azan in the Durban area. So for the listeners in the Durban area, it's time for the Isha Azan. We'll be playing the Isha Azan and continue after this, inshallah. Do stay with us.
This Azan is sponsored for the Isale Sawab of Marhum Muhammad Farooq Latib and all Marhumin. May Allah subhanahu wa ta'ala grant them the highest abode in Jannah. Ameen.
أعزائي المستمعين، حان الآن موعد أذان العشاء لمدينة دربن وما حولها. الله أكبر الله أكبر الله أكبر الله أكبر أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدًا رسول الله أشهد أن محمدًا رسول الله حي على حي على حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة والدرجة الرفيعة وابعثه مقاما محمودا الذي وعدته وارزقنا شفاعته يوم القيامة إنك لا تخلف الميعاد.
When the month of Ramadan arrives, the doors of mercy are opened. Sahih Muslim. From our home to yours, Simplex Radio wishes you, the Ummah of Muhammad sallallahu alaihi wasallam, a blessed Ramadan. May peace fill your hearts and homes. May your du'as and fasting be accepted, and may Allah shower His blessings on you and your loved ones. Ameen. Simplex Radio, the name you can trust.
These surahs after Azan are brought to you by Amina's Wonder Spice and Wonder Dates, 9 Peters Road, Springfield, Durban.
Bismillahirrahmanirrahim. قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد بسم الله الرحمن الرحيم قل أعوذ برب الفلق من شر ما خلق ومن شر غاسق إذا وقب ومن شر النفاثات في العقد ومن شر حاسد إذا حسد بسم الله الرحمن الرحيم قل أعوذ برب الناس ملك الناس إله الناس من شر الوسواس الخناس الذي يوسوس في صدور الناس من الجنة والناس.
This salah is proudly brought to you by Khan's Chemical Industry. May this salah enlighten your soul and bring about endless blessings throughout your day. This salah was proudly brought to you by Khan's Chemical Industry. May this salah enlighten your soul and bring about endless blessings throughout your day.
Having a clean, comfortable home is every homeowner's pride. That's why Khan's Chemicals have developed and manufactured prime yet affordable quality household brands. Starlight, Miracle Mum, Exterminate, and Angie to care for your home and family. With a wide range of fabric softeners, dishwashing liquids, bleachers, and all-purpose cleaners, pine gels, bubble baths, and much more, Khan's Chemicals ensures your home remains our #1 priority. For sales and other inquiries, call 011 933 4021. Khan's Chemicals, cleaning your home the way you want.
In South Africa, countless numbers of sick patients leave their homes at the crack of dawn to join long queues at clinics and public hospitals, many of them suffering pangs of hunger in addition to the symptoms of disease. The Al Imdad Foundation's Slice for Life teams deliver sandwiches to these patients at more than 40 hospitals and clinics across the country. Help us to keep on relieving hunger. Donate online at alimdad.com or call 0861 786 243 for more information.
My local dealer wants my car.
Sellers Cars want it more.
Auto wants my car.
Sellers Cars want it more.
But also wants my car.
Sellers Cars want it more.
Wow. Shall I give them a call?
They'll do more, help more, and you could even get more. 'Cause Sellers Cars want it more.
Well, that's more like it.
Everyone wants your car, but Sellers Cars want it more. Visit sellerscars.co.za or call 0678 678 678.
Radio Al Ansar, Durban, 90.4 FM. Peter Maritzburg, 105.6 FM.
You're listening to Medical Files, brought to you by the Islamic Medical Association of South Africa and hosted by myself, Faizal MJ Suleman. Our topic for discussion is management of disabilities from a biokineticist point of view. And we have in studio with us Brother Ebrahim Meer, who is a biokineticist practicing in Westville, Durban. Our number in the studio for your questions, which you may forward to us via WhatsApp, is 060-904-1056. Now, Ebrahim, we've got two questions that's come through. Assalamu alaikum. Kindly advise, I have prolapsed bladder. What exercises can doctor advise? Shukran, I'm 62 years old.
So you need to do lots of core stability, rehabilitation, and pelvic floor strengthening. So there are dedicated pelvic floor physiotherapy specialists that you do get that exist within our country, or you could visit a biokineticist as well. So lots of core stability. Why I say core is because your core is made up of basically lots of muscles that form an intramuscular cylinder that supports your back and spine. So all of this comes together with the pelvic floor as well, which is a group of muscles. You need to get those to become stronger and obviously start to activate again, and so you can get the core support that you need.
Thank you for that, doctor. Then, sorry, I'm calling you doctor. My apologies, Ebrahim. Another question that comes through. Assalamu alaikum, duas, you are well. Wa alaikum salam wa rahmatullahi wa barakatuh. I have been battling with a hemifacial spasm on the right side, affecting the eye and the jaw. It's been 2 years with constant twitching of the eye. Will therapy help? Jazakallah.
Therapy will help, and obviously in my experience, I've worked with someone like this before. But if you need to see a neurologist or another relevant specialist, that will also benefit you as well, just to make sure, rule out that it's not any other palsies that might be happening or something deeper than just what you may assume as a hemifacial spasm.
So it's better to go to maybe a
It's
neurologist.
subject to consultation.
Okay. Thank you for that. Now, one of the questions came through was that earlier you referred to autism, that you deal with autism. How does where does a biokineticist fit in when it comes to autism? Sorry, I'm being a bit basic about it, but that's how the questions come through.
No, so let's use a typical case study. You get an autistic child that is brought in, who has balance issues, sight problems, and coupled with a hearing deficiency. This patient can't communicate properly with their parents. The parent doesn't understand fully what they need from a physical perspective. So we try and obviously work on the presentation, so the physical presentation of the child. If you have a disability, maybe that's causing excessive tightness or limited joint range of motions, we try and promote wellness and obviously try and get the range back in the joints, try and get your posture a little bit better, so they could then have independency or keep being independent.
Thank you for that. I'm not going to pose the next question to you, but after the show, I will read the message to you. Okay. Yeah, all right. I've got, it says, okay, I'll read the message to you privately after this thing. During our discussion, just prior to the show, you were talking of home care and home-based care, etc.
Yes.
You'll discuss that with us.
Sure. So basically, we have a lot of people who see us who are dependent on others to help them. So you have a patient who comes in and they have a caregiver with them at most of the time. My message is to the patients who are at home and in bed or bedridden, or you can't really come out of your home setting. Make sure you make your surroundings accessible for you. So put in the relevant handrails. It wouldn't hurt to ask your occupational therapist to come in, have a look at your home, so you can obviously make it friendlier for you to move around if you have a disability. The other is, if you're in bed a lot of the time or you have a carer, make sure that you are turning, you're not laying on one position for too long. You could develop pressure wounds. So we've had cases where a patient could have done very, very well from a rehabilitation perspective and could have done very well from an exercise perspective, but they were limited because of bed sores or because of open wounds that prevented them from conducting the program. So another thing is the transfers. With spinal cord injuries and with other conditions, you have limited movement. So in such cases, transfer boards and transfer assist aids are needed. But what happens is most of the time is because patients cannot feel on certain limbs, they transfer awkwardly, or the carer pulls on their arm or tugs them in an awkward position, and that can actually damage or hurt a patient. So a simple course on management and care for a patient who is bedridden can be beneficial to home caregivers.
No, I think that's absolutely important because, many a time we find that some of the patients are injured because they're not handled properly by those caregivers.
100%. There's also something that we need to touch on is with strokes. If you just go back again, there's something known as a FAST principle. So we use this in cases where people suspect that they're having a stroke, which they don't panic. But for the people around the person with the stroke, use the FAST protocol. It stands for basically the F is your facial droop. If you have a droop on your face, if your arm drops, if you cannot speak properly, if you have a speech problem, make sure you time it properly and you get them to the ER on time. And that will benefit a patient having a stroke.
I think time is of the essence when one's getting a stroke. Is that correct?
100%.
Now, what happens to patients that have comorbidities? And say if you're dealing with somebody who's had a heart condition, but they've got other comorbidities, how do you adapt?
So in some cases, we can adapt it to a certain extent, but it needs to come from the patient themselves. So those active lifestyle modifications that we were talking about with regards to like smoking, overeating or undereating, right dietary choices, all of that comes from your patient themselves. So we can advise and we can give them our best opinion and look at the markers and do whatever relevant simple bloods that you need to do. But beyond that, the patient themselves ultimately is responsible for their own health.
Arthritis. If one's suffering from arthritis,
yes.
How can a biokineticist assist? Because you have arthritis of knees, hips, back, etc.
Yeah. So the fact that it depends on what arthritis you got, whether it's rheumatism or rheumatic arthritis, or you've got osteoarthritis. So with regards to osteoarthritis, in our case, we can help you because it means that obviously your joint surfaces have now worn out. In severe cases, obviously you'll need to see an orthopedic surgeon who might need to do joint replacements and joint surgeries to try and save your joint. But in cases where it's mild, you can alleviate a lot of your symptoms by doing rehabilitation.
A question that comes through is that I'm working in front of a computer for almost 8 to 9 hours a day.
Yes.
What effect is that going to have on my neck?
So you would probably develop something known as upper crust syndrome. So upper crust syndrome basically comes along from lots of desk jobs and obviously slouching forward or leaning forward towards the screen. You get sort of something known as a nerd neck. So anterior carrying of your neck, where you have your head bulging forward because your chest muscles become too tight and your shoulders become rounded. So I would say take regular breaks while you're doing any desk job. Make sure you're stretching and then strengthen up your back muscles and use an ergonomic chair. Ergonomically designed chair will assist you quite a bit as well. So make yourself comfortable, but at the same time, not too comfy to the point where you're not going to be taking breaks. You must take regular breaks to stretch and walk around, get the blood flowing, and then keep going.
Can people in heart failure exercise?
Again, depending on your level of heart failure, which side of your heart is failing and how many % of it is failing and what are your presenting symptoms. Subject to consultation, it's all dependent on those factors.
And let's talk about technology.
Yes.
How does technology and AI affect biokinetics? I should use the word assist, not affect.
So assist, I would say assist. So
assist, yeah.
I think it's pleasantly assisting us in the sense where in our practice we've implemented bionics. So it's wearable bionics. So it's an exoskeleton suit that patients are able to now wear to regain their walking ability. So if a patient with a stroke or a spinal cord injury has lost the ability to walk and they cannot take steps or ambulate, we are now able to, obviously with limitation in terms and conditions and all subject to consultation, we're able to now assist them in standing up and taking actual steps, which are symmetrical. This was a bit harder in the past because we didn't have the technology, but now that we do, the technology in that form is helping us, and also in the form of functional electrical stimulation. So we use a lot of electrical stimulation to make direct contact with muscle and with different functions of the body. So we don't have to rely solely on the patient activating a particular area or trying to. So even in the event of a patient unable to recruit a certain group of muscles, we're able to now stimulate and get movements.
Somebody asked if this is the lifeline. Yes, this is the lifeline. So you want to forward to us a question, you can forward to us. Immediately, we've got like about 2 minutes to round up the show. So we might just be able to deal with it. Now, Ebrahim, these conditions that we've discussed, the cardiac conditions, the stroke, etc.
Yes.
Now, it normally has a huge emotional and psychological effect on the patient.
Yes.
And when it comes to rehabilitation, these play a huge role.
Yes.
Now, how do you address the emotional, the psychological aspects of rehabilitation? Because you're already dealing with the physical.
Yeah. So that's a challenge, especially for us, because a lot of the time patients skip the psychologist.
Yep.
We have a stigma attached to seeing certain professionals. That's just human nature.
In fact, every time I interview one of these healthcare professionals who are in the in the mental in that field, that's my first question I pose to them. How do you deal with the stigma? But go for it.
So basically, it's hard, but I think positivity wins. So if you stay positive and you have a positive outlook on your recovery, you'd get the best out of it. The human body is designed to be moving, and we are made to move. So the minute you are sedentary, or you are sedentary for long periods, you find that disease and ailment sets in. So if I were you, if you have breath in your body and you have the ability to move, keep moving, don't stop. And to everybody that has a problem out there, stay positive. There's always light at the end of the tunnel. Professionals exist. Seek help, and you'll find it.
You'll find it, of course. Message comes to salams to Ebrahim Meer. Great content, very informative. Listening in with wishes, and comes from Amina Sheikh. Okay. We've got a minute to round up, Ebrahim. I'm sure you have a message for our listeners.
My message is start off 2025 with a positive mindset and be goal orientated, and you will reach your goal. Don't be negative about your conditions. Don't just depend on the drugs. Make an effort, make the lifestyle changes, and you should be good. If you need any help from us, you can find us on Instagram at Ebrahim_Meer_biokinetics, or you can contact our rooms, which I know a lot of people in the past year have been sitting on me for my line, the number 12 practice. We're currently re-establishing a connection, so that should be up soon, and I would be putting up a number soon. We have moved. We're now in Westville, so please come visit.
We'll do that. Ebrahim, thank you very much for joining me on the program this evening. Most appreciated. And of course, it has been undoubtedly very informative. I personally have learned a lot. I want to thank the engineers at the various radio stations for having engineered this evening, and I want to thank the listeners for tuning into Medical Files. Medical Files will be back with you next Tuesday evening at 8 p.m. inshallah. And before I leave you, I want to say to you, may you be in the care and protection of Allah subhanahu wa ta'ala. Until we meet again, from myself, Faizal MJ Suleman, do enjoy the rest of your week, and assalamu alaikum wa rahmatullahi wa barakatuh.
This segment is brought to you by